For many in southeastern South Dakota, Joe Keppen is known as Coach.
That's what I enjoy, is coaching my boys and coaching the other, kids in town and just various sports, but especially baseball.
During the off-season, he trades the ball field for the cornfield. 2 harvests passed, this coach found himself in quite the pickle.
No, it was actually a normal day and was helping out on the farm with harvest, and was actually driving a semi when I had my stroke. It was very strange. Like, my left side went weak, so I was actually on the phone and I dropped my phone, and I picked it up and was driving the semi and dropped my phone again, and then just drove in the ditch. A coworker was riding with me, and I was kind of showing him the ropes on driving and like what we had to do at the elevator. And luckily he was there because he knew something was wrong, or I was kind of trying to just think everything was fine and keep going. And he said, no, I needed to get help.
Honestly, really the one that saved his life is his coworker, because he recognized the symptoms and brought him right away. And that's what it really is all about.
Time is brain. So the first thing we want to do is differentiate, is it a hemorrhagic or an ischemic stroke? So is it a blood clot or is it a bleed? So that's why we get him to the CAT scan right away. Sometimes we'll even bypass coming to the emergency room first, and we just get straight to CAT scan.
And we could tell right away that he was in process of having a stroke.
Getting that imaging not only helps the team in the ER, but it also allows for an extra set of eyes. By bringing in a neurologist on the stroke team back in Sioux Falls, it can help direct treatment at the bedside.
So we get over through those checklists to make sure that there is no contraindication for the clot buster, and they get our interventionalist involved and get everything work out real quick so they can get to us on time or as quick as they can. And by the time the patient came to us, we are right at the door getting that patient in, quickly examining the patient and taking that patient to the cath lab to do the procedure.
That coordination of care allowed Joe to get clot-busting drugs in Scotland, and a short while later, he was in the Avera McKinnon cath lab, where the stroke team removed the clot that caused his stroke.
I was in intensive care for a couple days, and then stepped down bed for a while, and then I went to the Prairie Center rehab for 2 weeks, and then I was able to come home.
That quick stroke response, start to finish, was vital to Joe's recovery. Over a year later, and countless days of physical therapy, he's back in the driver's seat, assisting with the harvest. But for Joe, the call of the dugout was an even bigger motivator.
Well, I guess that was kind of one of my goals that probably helped me get through rehab, is I worked really hard at it because I wanted to get back to coaching the boys. That was my goal, to get back to coaching.
This past season, the coach made his comeback, and did so in grand fashion.
Watching it online was amazing. Watching those boys come back, and they did it for him.
It is fantastic. It is fantastic to see him. He's back to doing what he always did. It's great to see him with his boys at the ball game. It all could have been so different. So thank God that it wasn't.
Very, very lucky. Yep, very lucky.